Hello, and welcome to today's webinar, From Evidence to Impact, Understanding the Scope of Technology-Facilitated Abuse and How Data Can Help Inform Prevention. Thank you for joining us today. Today's session is being recorded and will be made available to registered participants. Please note that the Q&A and chat features in Teams are disabled. If you experience any technical issues, please contact our team at endtrafficking@acf.hhs.gov. Today, we will hear two brief presentations from federal staff at the Centers for Disease Control and Prevention and the Administration for Children and Families, focused on data demonstrating the scope of technology-facilitated abuse. After the presentations, we'll move into a panel discussion with three experts working to prevent and address technology-facilitated abuse. They will share how data informs and strengthens their work. And to get us started, I'd like to welcome Kevin Malone, HHS Senior Advisor on Human Trafficking, to provide opening remarks.
Hello, everyone, and thank you for joining us today. This is the second webinar in a series we're hosting with our partners at CDC. I want to thank them for their continued partnership and for working with us on this very important issue. In our last webinar, we talked about prevention education and the importance of sharing strategies that work with schools and communities. That conversation showed the impact we can have when we work together. If you missed it or would like a recap, the recording is available on ACF's YouTube channel. Today, we're focusing on data related to technology-facilitated abuse, why it matters, what it can tell us, and how we can use it to improve prevention and response. This is a real priority for us here at HHS. Technology-facilitated abuse is a serious and growing concern. We are looking closely at every opportunity to better prevent it, identify it, and respond when it happens. You will see from the presentation today that this issue overlaps with many types of abuse, including human trafficking, child abuse, domestic violence, sexual abuse, image-based abuse, and teen dating violence. This isn't something any one agency, program, or community can solve alone. Everyone has a role to play. Federal partners, schools, service providers, community organizations, technology partners, families, and young people themselves. Data can help us do this work much better. It can help us understand what is happening, who is being affected, where the risks are changing, and where we need to focus our efforts. The more we know, the better we can spot trends, strengthen prevention, recognize potential abuse, and connect people to the right support. But we also have to use data carefully. We need to know what information is reliable, what is evidence informed, and how to turn what we learn into practical action. Our goal is simple: prevent harm before it happens and respond quickly and effectively when it does. I hope today's conversation helps us all better understand the scope and the impact of technology-facilitated abuse and how data can help guide our response. Thank you for joining us today, and thank you for the work you do to protect children, families, and communities. With that, I'll turn it back over to Catherine.
Thank you so much, Kevin. In my excitement to kick us, I'm the director of the Office on Trafficking in Persons, and one of our closest day-to-day partners. Our colleagues are at the CDC, and to introduce Reshma Mahendra. She's the acting director of CDC's Division of Violence Prevention, and I welcome her to provide opening remarks from the CDC.
Thank you so much, Catherine. As Catherine said, my name is Reshma Mahendra. I am the acting director of the Division of Violence Prevention here at the Centers for Disease Control and Prevention, and we are particularly thankful for the collaboration with OTIP and ACF. These webinars are just such a wonderful way for us to bring attention to this important topic. So we're looking forward to the conversation. Tech-facilitated abuse is a critical topic for us that we're beginning to understand much more about. It is an agency and administration priority to protect youth from harms from all places, and including social media and the digital environment. So we are really looking forward to talking to you about how we can use data to understand ways that social media is used to commit violence, and then using that data to help inform prevention action. And that's particularly another reason why we're excited to have this conversation today, because everything we do at CDC, the data we collect, the science we conduct, is all to inform practice, and the best available evidence is used in communities to make a difference. And so this is the start of a conversation that we will continue to have, and I'm looking forward to the discussion and what we learned here today. So thank you all so much. And again, thank you all for participating, and thank you to OTIP and ACF for being such wonderful collaborators in this work. So with that, I will introduce you to my colleagues who are going to present some recent national large-scale data on the scope of tech-facilitated abuse. The next two speakers are, and if you want to go to the next slide, are Nicole White, who is a health scientist in the Division of Violence Prevention, and Sharon Smith, a behavioral scientist also in our division. They're going to discuss both CDC available data and some publicly available data, and I will turn it over now to Nicole to start us off.
Thanks, Reshma. So good afternoon. Next slide, please. We will first be starting with global data, and then we'll move into some of our CDC domestic data. Next slide, please. Next slide. Thank you. So CDC's Violence Against Children survey has been conducted in over 25 countries among children and youth aged 13 to 24 years old. And it really asked about a host of different violence and health-related experiences amongst youth. We here at CDC have data on tech-facilitated violence in both Namibia as well as Tanzania. So the data in Namibia was collected between March and June of 2019. Next, please. And in this data, we have seen that among teens 13 to 17 years old, 5.9% of females and 7.3% of males reported they had at least one unwanted online sexual experience within the past 12 months. 3.3% of females and 3.8% of males reported 2 or more types of unwanted online experiences in those same past 12 months. And this included things such as receiving unwanted sexual advertisements or links, receiving unwanted sexual messages, images, or videos, being asked for sexual information or to talk about sexual acts, or being asked to share sexual photos or videos when they did not want to. Now, among those aged 18 to 24 years old, 17.5% of females and 15.4% of males reported that they had experienced at least one unwanted online sexual experience in the past 12 months. And 13.4%, 13.4% of females and 10.2% of males aged 18 to 24 reported 2 or more types of unwanted sexual experiences within the past 12 months. Next, please. So now turning to our Tanzania data, again, this was collected with youth aged 13 to 24 years old, and this data was collected between March and June of 2024. Next. So in Tanzania, 1% of females and 4.7% of males reported they had unwanted technology-facilitated sexual experiences. And in the Tanzania data, this included being pressured to talk about sexual acts, sending photos or videos against their will, or doing anything else sexual on the internet, social media, through email, or text messages. Now, uniquely, Tanzania also has data on the perpetration of tech-facilitated violence. And so with this data set, we found that 4.9% of females and 9% of males reported pressuring someone to actually talk about acts, sexual acts, send photos or videos, or do something else sexual via technology when that other person did not want to. Next, please. So now, turning towards some of our CDC domestic data, I'm going to go over our rapid survey system. So the rapid surveys from the National Center for Health Statistics collect timely, relevant data on topics of public health importance. Surveys are conducted several times a year and include a unique set of questions about a whole host of different public health topics. These are collected amongst adults aged 18 and older, and the data that I'm presenting today was collected between October and November of 2023. I'm also going to show you overall percentages in parentheses. Oh, that's okay. In parentheses for those aged 18 to 44 years old to try to capture a bit younger group. So you'll see on the slide that 4.4% of the adults surveyed said that they had ever had a revealing or sexual photo or video emailed, texted, or electronically posted without their consent. And then if we take a look in the parentheses for that younger group there, you'll see that it's 7.3% of those aged 18 to 44 reported that they had had these experiences. When you break that down by sex, it was 5.2% of females and 3.5% of males. Now, the second statistic down there are for those who had reported that they had ever had fake pornographic photos or videos created or shared online without their consent, and 1.3%, excuse me, of adults 18 and older reported that they had had this experience. And when we looked at the subgroup of those who were aged 18 to 44 years old, that number increased to 2.3%. And when you look at the sex breakdown, it was the same among males and females. Next slide, please. So in this data set, we also found that 4.9% of adults reported that they were threatened with sharing a revealing or sexual photo or video through the internet, social media, email, or text message. And then amongst that younger group from 18 to 44 years old, this actually increased to 7.9%. Next slide, please. So next, we asked this group of 4.9% of adults the reasons that they were threatened with sharing a revealing or sexual photo or video. And this really greatly helps our understanding of why this is occurring, in turn, providing really valuable data for our prevention efforts. So among this subsample of 4.9% of adults who reported being threatened, 33.7% of them said that they were threatened in order to receive additional sexual photos or videos. And you'll see the sex breakdown here was 42.1% of females and 25.5% of males. Next, please. Moving now to those who said that they were threatened in order to have a sexual relationship, 34.9% of this subsample reported that they were threatened in this way. And the breakdown by sex, it was 48.8% of females and 21.5% of males. Next, please. Now to those who reported being threatened in order to get money, 45.6% of the subsample reported that they had experienced this type of threat. And here, interestingly, you'll see that there is a greater difference between males and females, with females being at 18.9% of the subsample, and males being 71.1%, reporting that they had experienced this type of threat. Next. We next have our group that say they were threatened in order to actually stay in or maintain a relationship. And so that was 35.6% of the subsample, and the breakdown by sex was 50.7% of females and 21% of males. And then finally, next, we've got folks who say that they were threatened for some other type of reason. And this was 28.3% of the subsample, and the breakdown by sex was relatively similar. So I will now pass it on to Sharon Smith to talk about another available data source.
Thank you, Nicole. So Nicole presented some findings from CDC's rapid survey system, which is an adult data set assessing tech-facilitated violence. Now, I'm going to review a complementary data set from Thorn that is focused on youth. Thorn is a nonprofit organization that's focused on child safety. So this is not a federal data set as we shared up to this point, but the Thorn organization has conducted research to examine the attitudes and experiences among youth regarding online threats and behaviors. Okay, next slide. So the data points on this slide are based on similar questions as what Nicole presented. So they're complementary to the RSS data. So the data show that among those aged 13 to 17, 21% of girls and 19% of boys experienced someone threatening to share a sexual image of them with another person or post it online to make them do something. And looking at the reasons for sharing their own sexual images, among victims who knowingly shared their images, 74% said that they did so because they felt coerced or manipulated. 71% said it was due to relational reasons, such as they trusted the person or it was a normal or expected part of dating, or that they desired the relationship. And 25% said that sharing their images was linked to some sort of commercial incentive. So keep in mind that this is a younger age group, so it might explain the difference between these results and the RSS data, even though the questions were similar. And we have included the citation to this report at the bottom of the slide if you want to learn more. Okay, next slide. Okay, now I'm going to talk about some data from another CDC surveillance system, the National Intimate Partner and Sexual Violence Survey, otherwise known as NISVIS. Next slide. NISVIS is an ongoing nationally representative survey which collects information about experiences of sexual violence, stalking, and intimate partner violence, victimization among non-institutionalized English and Spanish-speaking U.S. adults, and it's managed by the CDC. For the 2023-2024 survey, we added some new questions to capture technology-facilitated victimization. So here we have the tech-facilitated sexual violence questions. The first item was having received an unwanted sexual message or image. So lifetime prevalence was 26.9% for females and 14% for males. And in the 12 months before taking the survey was almost 10% for females, 6.3% for males. Second item was that the victim's sexual image was distributed without their consent. Lifetime prevalence was almost 7% for females and about 4% for males. And 12-month prevalence was 1.9% for females and 1.7% for males. Okay, next slide. And we also collected data on technology-facilitated stalking tactics. So for some context, overall about 1 in 5 women and 1 in 10 men in the United States were stalked in their lifetime. This slide shows percentages among victims who experience different forms of tech-facilitated stalking. So this isn't all the tactics that we measure in this, but just the tech-facilitated stalking tactics. So this slide shows that about 47% of females and 54% of males received unwanted messages through social media. About 36% of females and 44% of males were monitored or tracked through social media without their consent. 20% of females and 25% of males said the stalker used some type of technology to monitor their communication and activities. Almost 16% of females and 29% of males said they were tracked with GPS without their consent. And 12.6% of females and 19.5% of males were watched or spied on with a hidden camera by their stalker. It's important to note that we did not do significance testing, so the women and men should not be compared. But this gives you an idea of the range of the tech-facilitated stalking that was experienced by victims. These data and our other NIST reports are available on our CDC webpage, so we encourage you to check those out. And now I'll turn it back to Catherine. Thank you.
All right. Thank you both to Nicole and Sharon for giving us an overview of large-scale data sources to help us better understand the scale and scope of technology-facilitated abuse. At this point, we're going to transition to the second panel. They're going to focus on sharing some preliminary findings from in-progress and future data sources on the scope of tech-facilitated abuse. I'm going to invite Kara Zuckerman from the CDC Violence Prevention Division and Patty Fanflick from the Office on Trafficking in Persons to hop on and share a little bit more about their preliminary and future in-development findings.
All right, thank you, Catherine. Next slide. All right, one more. Okay, so this is mainly, my part is mainly about future data, but I do want to tell you about some very exciting future opportunities for data. The first source of future data that I want to draw attention to is a manuscript in progress in the National Center for Injury Prevention and Control at the CDC, looking at suicides involving technology-facilitated abuse using the CDC's National Violent Death Reporting System, or NVDRS, a surveillance system which compiles detailed information on suicides and other types of death in the United States, the District of Columbia, and Puerto Rico. Each NVDRS incident is coded by trained abstractors who integrate death certificates, coroner or medical examiner records, toxicology reports, and law enforcement reports for each incident. There are hundreds of unique variables available for each incident, including characteristics of victims, circumstances precipitating the incident, and coroner or medical examiner and law enforcement narratives providing additional context surrounding the event. This manuscript is using a large language model to extract narrative text from the coroner or medical examiner and law enforcement reports within each suicide incident from 2017 to 2024 to capture suicides involving technology-facilitated abuse. The narratives will be coded into categories such as characteristics, risk factors, and precipitating circumstances. The manuscript is estimated to be completed this fall and submitted to a journal. All right, so in addition to what Nicole shared on our global violence against children survey, I wanted to share a little about the domestic VAX. In 2024, our division conducted the first ever VAX domestically in a pilot study in Baltimore, Maryland. Nearly 400 youth, 13 to 24 years old, were asked about their experience with unwanted technology-facilitated violence. We are hopeful that the full report will be available very soon on our partner website, Together for Girls. And finally, a future space for youth-based surveillance of tech-facilitated abuse is CDC's Youth Risk Behavior Surveillance System. The YRBS measures health-related behaviors and experiences that can lead to death and disability among youth and adults. Results help monitor health trends, identify emerging issues, and plan and evaluate programs that can help improve adolescent health. We are currently exploring options for using this avenue for future data collection on tech-facilitated abuse. And now I will pass it over to Patricia Fanflick. I think, Patty, you're muted on my end at least.
Thank you so much, Kara. Sorry about that. Building on those examples of emerging data sources for technology facilitated abuse, or TFA, I wanted to highlight another source, specifically OTIP's Shepherd Case Management System. Shepherd is a secure online case management system housed within the Anti-Trafficking Information Management System of ATIMS. It is used to submit, review, and manage trafficking-related requests for assistance. Authorized external requesters use Shepherd to submit and monitor requests, while OTIP staff use the system to review, assess, process, and manage requests involving individuals who have experienced human trafficking. For our current TFA study, we use narrative information submitted in Shepherd because these case-level descriptions provide context that not only is captured in structured fields. The narratives allowed us to first examine how technology may be used across trafficking types as a mechanism of coercive control, and then how these patterns may differ for males and females. Next. Thank you. We conducted a qualitative inductive content analysis of narrative records from FY 2022 through FY 2024. Among this 6,477 child trafficking related cases, 803 cases, or 12.4%, contain documented indicators of TFA in the narrative text. Of these, 307 involved males and 496 involved females. Because there was no structured TFA field, we used keyword flagging to identify likely narratives, followed by inductive codebook development and double coding with adjudication. We then interpreted the patterns through a coercive control framework. In other words, we looked beyond the single incidence of abuse or force and then examined how different tactics work together to create dependency, fear, compliance, and entrapment. Our overall findings suggest that TFA functioned as a form of coercive control by increasing surveillance, isolation, threats, dependencies, and barriers to exit. Technology didn't replace coercive control, rather it extended its reach, persistence, secrecy, and speed, making control possible even when the perpetrator was not physically present. In the sex trafficking cases, narratives involving females more often reflected relational grooming, romantic manipulation, gradual escalation, and shame or family-based threats. Narratives involving males more often reflected a rapid sextortion, humiliation, transactional leverage, and persistent direct contact. In the labor trafficking cases, narratives involving females more often centered on domestic servitude, home-based confinement, and food or shelter as leverage. Narratives involving males more often involved external labor coercion, physical intimidation, debt pressure, and school being replaced by work. Next slide. We also saw differences in disclosure patterns. Narratives involving females more often describe disclosure to trusted adults, such as a clinician, caseworker, or a female relative. Narratives involving males more often reflected minimization, calm or stoic presentation, or disclosure only after direct behavioral specific questions were asked. These patterns suggest that females and males may show different pathways to disclosure and different indicators of coercion. So screening should look at patterns rather than a single sign or an incident. These findings can help inform screening, training, and service responses by encouraging providers to ask more behavioral specific questions about phones, phone use, social media, image-based coercion, restricted communication, surveillance, and technology used to create dependency or fear. Screening often emphasizes in-person or physical indicators, but tech-facilitated coercive control can operate continuously and at a distance through surveillance, isolation, reputational threats, and digital blackmail. Because risk, disclosure, and service needs may differ for males and females across trafficking types, assessment and response should be individualized rather than a one-size-fits-all approach. Thank you so much for your time, and I'll pass it on to Catherine Chun.
All right, thank you so much, Kara and Patty. Now I'm going to welcome our third and final panel. For everyone joining online, we've been kind of going macro and then distilling it down, and our third panel is really getting the perspectives of people on the ground who are putting the data into practice. So I will invite Aria Flood, who is with Love 146 as the Managing Director of U.S. Prevention, as well as Kate Kiesel, co-founder and co-chief executive officer at Sinar Institute, and Elizabeth Payne, the legal director at the Chicago Alliance Against Sexual Exploitation. So to start us off, I just want to invite each of those three panelists in the order of Aria, Kate, and then Elizabeth to introduce yourselves and give us a sense of what programs your organizations implement, guided through the type of data that's been presented earlier during our time together. All right, I don't see Aria on. So Kate, I'm going to turn it to you and then come back to Aria. She may be having some technical difficulties.
Sounds good. Can you hear me?
Yes.
All right, wonderful. Thank you so much, Catherine. Good afternoon. My name is Kate Kiesel, and I am a licensed clinical social worker, a trauma therapist, and I'm the co-founder and co-CEO at the Sinar Institute. As a clinician and lived experience leader, my work has focused for many years on complex trauma, interpersonal violence, systems change, and understanding pathways to healing. At Sinar, we provide a full spectrum of trauma-conscious mental health and wellness services for individuals and communities impacted by interpersonal violence, alongside training and technical assistance and organizational well-being programs that are focused on creating sustainable and trauma-responsive workspaces. Our work is grounded in evidence-based practices, emerging neuroscience, and most importantly, the wisdom of lived experience. While we have been working on the issue of technology-facilitated violence really since our organizational inception, we've seen rapidly growing and evolving forms of digitally enabled violence perpetrations within human trafficking, sexual violence, domestic violence, stalking, and other forms of interpersonal harm. In 2019, we began increasing our data collection around technology-facilitated violence to better understand typology and the traumatic impact of this violence within the communities we serve. We found that technology-facilitated violence was occurring across all age and demographics with our clients, and many individuals reporting non-consensual sharing or threat of sharing their intimate images, stalking, harassment, doxing, surveillance, monitoring, impersonation, and countless other forms of digital harm that extended the abuse far beyond physical spaces. We've also begun to understand the far-reaching, ongoing, and so often ceaseless impact of technology-facilitated violence on our clients' lives through new types of safety concerns and devastating mental health outcomes, including a documented increase in suicidal ideation and completion. In response to those findings, we launched a small pilot project that we would eventually formalize as our Project Lighthouse program that was initially funded by the Office for Victims of Crime in 2023. Project Lighthouse is our national initiative focused on addressing technology-facilitated violence through direct services and capacity building efforts through training, technical assistance, and the development of tools such as screening instruments and standard of care protocols. It is truly an honor to be here today and share a bit about the ways in which data informs our work within Project Lighthouse and to learn from the fellow panelists.
Thank you, Kate. Aria, good to see you back. I'm glad your tech issues were solved. I'm going to turn it to you and then go on to Elizabeth.
Thank you so much, Catherine. Yeah, good afternoon. My name is Aria Flood, and I'm the Managing Director of U.S. Prevention at Love 146. Love 146 is a social service organization working to end child trafficking through prevention, education, and survivor care. I have over 15 years of experience in youth program planning, implementation, and evaluation with an emphasis on school-based prevention education programming. As a managing director of U.S. Prevention at Love 146, I'm responsible for developing, promoting, and scaling the Not a Number prevention curriculum to help build protective factors in youth. I recently celebrated 10 years at Love 146, and during that time have supported the development of 3 of the 4 iterations of the Not a Number prevention curriculum, the focal point of our prevention. The program is currently implemented in over 30 states and reaches thousands of youth every year. Additionally, Love 146 prevention team trains professionals to recognize risk factors and potential indicators that youth may be experiencing exploitation. And we resource caregivers to have conversations with the young people in their lives about consent, online safety, healthy relationships, and safety planning. Our hope is that as we equip youth with the knowledge and skills to stay safe in potentially exploitative situations, we're also building an ecosystem of support with the adults in their lives. I'm a former Teach for America Corps member and a middle school science teacher, so in tandem with this work, I've spent the entirety of my career working with and learning from adolescents. I'm excited to be here today.
Thanks, Maria. Elizabeth?
Yeah, thanks, Catherine. So hi, everybody. I am the legal director at the Chicago Alliance Against Sexual Exploitation, which is usually known as CASE. We're a nonprofit legal services agency for survivors of sexual assault, cyber sexual abuse, and sex trafficking. Our legal services include crime victims' rights representation, criminal records relief, civil lawsuits, employment law, educational advocacy and Title IX work, cyber sexual abuse, and protective orders. I'm also a lecturer in law on gender violence at the University of Chicago Law School. And prior to coming to CASE, I was a senior assistant district attorney in the Special Victims Bureau of the Brooklyn District Attorney's Office, where I prosecuted sexual assault and the sexual and physical abuse of children. Our work at CASE involving victims of technology-facilitated abuse includes serving as crime victims' rights attorneys during criminal prosecutions and at the reporting stage in criminal cases, assisting with obtaining protective orders, and then we also assist with various forms of civil litigation, both at the state and the federal level. So we've won various lawsuits against perpetrators of non-consensual dissemination, which is commonly referred to as revenge porn, as well as synthetic intimate images, which are commonly referred to as deep fakes. We're one of the only legal service providers in the country that offers free, holistic legal assistance for cybersexual abuse.
All right, so we have the perspective of services, prevention, advocacy programs. Earlier we heard a lot of different data sets that are beginning to be put into use. Can you describe in each of your respective program areas how data has informed the practice and the services and the prevention on the ground, especially if it's helped to change the way you are adapting to the local needs? And for this, I will start with Elizabeth and then go to Aria and Kate.
So for us, the landscape of technology-facilitated abuse has been changing really dramatically because of the rise of artificial intelligence. And in the past few years, we know there's been an enormous increase in non-consensual creation and dissemination, especially of synthetic intimate images. That particularly has really increased just in the past few years. So again, that's commonly called deepfakes. And one of the data points that I think is really striking about how this issue is really changing and growing right now, it comes from the National Center for Missing and Exploited Children. It's also referred to as NCMEC for those of you who are familiar with that acronym. So NCMEC provides data about its reports to its cyber tip line, and their reports specifically regarding synthetic intimate images of minors has really soared since 2024. In the first 6 months of 2024, there were 6,835 reports of deepfake synthetic intimate images of children. And then in the first 6 months of 2025, so just 1 year later, that number jumped to 440,419. So a 6,300% increase in tips to NCMEC. So the way we use numbers like this is it lets us know that we need to prepare internally for an increase in cases and requests for assistance. There's going to be an increased demand, and we already had a really high demand before this, right? So there's not a lot of attorneys, and especially nonprofit attorneys, who specialize in cybersexual abuse. So those who do have that specialization really are seeing an increased demand. And at the same time, there's a really pressing need for the laws to adapt and respond to the changing landscape of technological harm. So we're also increasing our policy work in these areas as well. In the past year, we've allocated resources to address the increased need that we're seeing for legal assistance and policy work in this specific area. And we've also had to adapt the way we select our cases that we choose to represent, because we want to now focus on the ones that we think will create the most helpful precedent, and perhaps, create better law for more people going forward, because we can't represent we can't represent everyone who comes to us for services, right? So we have to be selective, more selective than ever. We also try to engage in prevention work through educational presentations that we do, so that we're doing our part to keep the numbers from growing even more.
Okay. Maria?
Yeah, thank you, Elizabeth. Yeah, Level 146 uses data on technology facilitated abuse, and I think we'll all probably just keep saying TFA as an acronym, to directly inform how we approach conversations with young people, how we develop activities for curriculum implementation, and how we build caregiver content. The data is critical in helping us curate relevant, informative, and youth-centered knowledge building and safety planning activities based on the trends and risks we're seeing emerge in the digital space. By analyzing TFA data, we're better able to identify high-risk platforms, grooming tactics, and patterns of online exploitation, allowing us to tailor prevention education to the realities that young people are currently navigating. Without this data, it'd be much more difficult to accurately pinpoint where risks are occurring and ensure our prevention and response efforts remain timely, informed, and effective. During our curriculum rewrites a couple of years back, we began our brainstorming sessions by identifying all of the latest trends in trafficking. We read the latest research and identified spaces where we needed to alter or develop content to incorporate those learnings into the program. What emerged was a revamped Module 2, that probably doesn't make any sense, but focused a little more on generational norms with a more robust discussion on digital behavior, including everything from sextortion to conversations on AI-generated imagery. We've seen remarkable engagement with the module, and youth consistently share their experiences of people they've met online, requesting nude images and videos. And having these conversations early may help prevent future exploitation or additional tech-facilitated abuses, because we can help young people understand the off-ramps and the ways in which they can pause these conversations and seek support from a safe adult.
Thank you. Kate?
Thank you so much. And thank you, Aria and Elizabeth, for the really, really critical work that you're both leading. So at SANAR, one of the primary ways we use data through Project Lighthouse is to identify both service gaps and emerging patterns of harm related to technology-facilitated violence. On our capacity building side of the shop, the data becomes really important to help us craft field responses that are grounded in actual provider needs and preferences, rather than assumptions of what we might make are important. So recently we conducted a national provider survey that helped us identify trends that really were critical in forming our capacity building priorities. Some of the most significant findings of the survey were that less than 12% of providers reported utilizing formalized screening tools to identify technology-facilitated violence. And in addition, less than 14% of providers reported feeling sufficiently prepared to respond. These findings were incredibly important because they highlighted that many systems are still operating without standardizing screening processes, validated tools, formalized protocols, or organizational training. And what the data very clearly told us is that we urgently need national training and technical assistance and practical implementation strategies for screening. As a result, we're currently in the early stages of developing and piloting a multi-level screening tool for technology-facilitated violence. These tools will help support both our own direct client work and are designed to support broader field-wide screening, identification, and data collection related to technology-facilitated violence. The survey also really helped us understand prevalence indicators that further reinforce the pervasiveness of this form of violence. 98% of respondents reported that they had provided services to at least one survivor of technology-facilitated violence. And of this, 70% reported that they had served individuals impacted by image-based sexual abuse, and 67 reported that they were working with clients who were impacted by online harassment and threats. While I could really talk about this all day, I think the most important thing to highlight is that these kinds of findings help us narrow our focus in actionable ways. Technology-facilitated abuse can feel so incredibly vast. It can feel overwhelming, but data allows us to identify where immediately we can focus on interventions that are most needed, where systems might be underprepared, or really where different providers are open to gaining different forms of support. So this can help us to target efforts that will have the greatest impact, knowing that this is always going to be a resource lean space.
Thank you. I think between the three of you, you covered a pretty wide spectrum of data-informed practice. One, to understand the volume of need, especially in tech-facilitated abuse, to target prevention efforts, not just in terms of like the recruitment and exploitation schemes, but where it's happening. And then, Kate, when you were talking about the targeting, often violence prevention and responses to violence seem so overwhelming, especially within the tech facilitated space, because again, you look at the data that was presented earlier during our time together, it's just like, millions of tips going into NCMEC and people responding in those ways in all those national surveys. So it's really interesting to hear the wide range of ways you're using data to inform practice. And I'm sure there are a lot of tips in there for other participants on this call, and others have their own data-informed practices to share as well. But what about the challenges? So you talked about effective use cases. Where do you find the challenges in trying to leverage data to inform the day-to-day practice of the programs that are delivered through your organizations?
I'll start. As with most forms of exploitation, I think accurate data, comprehensive data on tech-facilitated abuse is still kind of hard to come by. And so when developing content for young people and their caregivers, instead of focusing on numbers or recent incidents, we focus on what the data reveals thematically. The ages at which young people are first experiencing online grooming, as well as the methods and platforms most commonly used to coerce, manipulate, or exploit them. This approach allows us to provide developmentally appropriate guidance that reflects the realities youth are navigating online today. Increasingly, research is showing that the first age of image solicitation is younger than practitioners and caregivers are prepared for, as early as 9, according to a 2020 study from Thorne. However, a limitation with putting this data into practice is that often people feel wary of talking to 4th and 5th graders about sending partial or full nude images, as they worry it's too young and would otherwise introduce an unfamiliar concept to them. The team at the Crimes Against Children Research Center has published several peer-reviewed studies on tech-facilitated abuse, including important research on childhood image-based sexual abuse. Their work has helped our team better understand some of the dynamics that are most common across digital platforms, particularly peer-to-peer incidents involving young people themselves. Helping caregivers and youth-serving professionals understand tech-facilitated abuse without jumping to no devices has been, a limitation of putting research into practice. I think It's normal to be reactionary in these circumstances, but prevention repeatedly shows us that we must give youth the knowledge and help them practice skills they need to stay safe in the environments and conditions by which they live. In this case, it's using those skills to navigate online interactions that are often taking place independently.
Kate?
Thank you. So I'm sort of going to paint the larger picture and then scale down a little bit into the challenges. For us at the Sinar Institute, one of the most important data sets we have is on healing outcomes in the aftermath of technology facilitated violence. So one of our primary outcome indicators is healing itself. So we measure things like resilience, hope, ongoing trauma exposure, and post-traumatic growth. And this data is incredibly important in our work because it helps us to better understand the most meaningful type of services that individuals are receiving and how these supports correlate with safety, resilience, and healing-centered outcomes over time. For example, we're able to use data to better understand our service model, which is grounded in the belief that all clients should have access to no-cost services without caps or session limits or arbitrary timelines. We're able to see through our data positive correlations that individuals are able to achieve long-term healing, increased indicators of resilience, and meaningful post-traumatic growth. And this type of longitudinal healing data has significant implications because it allows us to make decisions that are evidence-informed rather than assumption-based. And it also helps us to advocate for sustainable care models, trauma-conscious funding structures, and long-term support rather than short-term crisis-only intervention. At the same time, while this type of healing and resilience data is really the most meaningful in my perspective that we could collect, it also requires the greatest level of ethical care and intentionality. At Sinar, we strongly believe that data collection should always be person-centered, it should be client-led, should be conscious of people's traumatic experiences, and most importantly, optional. So for example, clinical evaluation scales that are assessing hope, resilience, or trauma symptoms should feel meaningful and supportive to the individual. So as a clinician and a lived experience leader, I think it's important to acknowledge that for some individuals, these scales can be incredibly empowering. They can help us quantify our growth, recognize our progress, and witness change over time in ways that feel really tangible. But for others, these same measures may feel overwhelming, misaligned, emotionally activating, or they simply don't support their own healing journey. And because of that, we believe these measures should always remain optional and that individuals should never feel that there are organizational expectations or pressure to participate in evaluations or research in order to receive care or quality support. Yet practically what this means is that we may not always have perfect or complete data sets in ways that yield sort of that large scale, important, statistically robust conclusion. But our core value as an organization is that the ethical trauma conscious care has to come before data collection. And sometimes this slows the data set progress.
Elizabeth?
I appreciate the way Kate fielded the question because I also want to sort of elaborate a little on how we've used some of the data because data like the ones I mentioned earlier from NICNIC and things like that helps us illuminate how big the problem is right now and the way the scope of harm is changing really rapidly. It's really hard to convey that to those who are not working in this field specifically, right? Practitioners just in the legal services industry, for instance, are not familiar with like how big the need is. So when I have a data point that I can take when I'm going to a pro bono workshop or talking to somebody and trying to convince them that they should be doing a case like this, it really helps me generate interest to get attorneys to volunteer their time and take some of these cases. It also helps us with legal arguments when we're submitting a brief about what's going on in a case or the scope of the harm. The judiciary is still learning about these issues too, right? And how to handle how these problems come up in the legal context. And so when I have a data point that I can use, it really helps me explain that to the court. But data has its limits, right? And one of the things I think can be a downside with data is that you don't always capture the humanity of an individual when you're using numbers, right? And so a specific person's story and account is sometimes just as powerful as a data point. And I think that that's one of the things that really has to be used and captured when we're using data in the ways that we're talking about, is that these are individual people's lives too. Each one of these numbers is somebody's personal experience, and being able to convey that humanity of a person's situation can be really important too. So just in terms of the challenges, that, and then also I think helping to really convey the level of harm that's happening right now, how much things have changed even in the past few years, and then also the implementation of, like, how do we translate data to change, like policy change? How do we create better laws? How do we create better policy to address the data that we're seeing, right? All of those are the different challenges that I think we face when we're working with data.
Yeah, so we love data-informed practice, but also you all surface the ethical complexities in terms of implementation, the challenges, like the discomfort of actually doing the work that's informed by the data, and then never forgetting the human being behind every data point, and these are not just numbers. So just super rapid fire, final question. We've kind of looked at mostly the present of what are we learning from these data systems, how are people putting into practice limitations, but kind of future thinking, future forecasting, where a little bit of your perspectives of what are we missing at this point? Where do you think people, how do we want to understand how technology continues to evolve and the abuses of technology evolving? So I'm going to go in the same order: Aria, Kate, Elizabeth, and then we'll close out from there.
Okay, I know we're at time, so I'm going to try to condense this a little bit. In preparation for this webinar, I asked a friend who's a researcher in this field what her thoughts are on technology facilitated abuse, and she responded. I also wanted to say that from my perspective, we need much more information about what kids share and why. We know that the majority of child sexual abuse material is youth produced. Far fewer of these youth are likely perpetrators in the way we think about that term in traditional abuse. So there's a disconnect there. What does that mean for treatment, help seeking, and prevention? More mixed methods research can help us with that answer. I think there's a great deal to unpack here. Research has long shown that youth are often the primary perpetrators of problematic sexual abuse against other youth. At the same time, framing tech-facilitated abuse as only intentionally harmful behavior does not fully capture the complexity of what's happening online. More often, I think it's shaped by peer dynamics, developmental factors, coercion, social pressure, and the unique ways that technology changes how young people interact and make decisions. So the numbers alone won't tell the story. We've got to start learning anecdotally from young people who have reposted, generated, or requested these images from their peers about their why. That qualitative why will inform our work in prevention for years to come.
Okay.
Beautifully said, Aria. That took a lot of the areas that I had hoped to cover as well. And I think, Elizabeth, you talked a lot about the human stories that we're telling and what it means to be good stewards of that data. So just, I think the last piece that I would want to highlight, which really connects to my last piece that I shared, was that we can't have good data if we don't have ethical, trauma-conscious, person-centered, trusted systems of care, because without those systems of trust being present, individuals won't feel comfortable or safe to tell their full stories. So if we think about things like stalking, coercive control, digital violence, and we're talking about really deep, vulnerable pieces of life, we're talking about people's experiences with fear, autonomy violation, safety risks, degradation of dignity and harm. We're really attempting to quantify deeply complex human experiences. So if people don't feel believed, protected, understood, and supported, we may never have those stories. They may never be fully disclosed, and then they won't be documented in our data. So ensuring that we're creating trusted spaces where people can share the complexity of their experiences and developing similarly complex and nuanced solutions is deeply central to what CINAR believes around data.
So yeah, I was very excited about the data that was shared early on in this webinar regarding sextortion specifically, because that is an area that I think we have not had enough data. It's very underreported. There's a lot of shame and stigma. People don't want to talk about it or come forward, and it's a really rapidly growing issue. So I was happy to see that. I think two other areas that I'm very interested in seeing more data in, just as a practitioner, is today actually is the day that the Take It Down Act, which was signed into law last year, one of those provisions goes into effect. So it's a provision in the federal law that says websites and platforms must remove non-consensual images within 48 hours upon receiving a request from a victim. And that goes into effect today. So I'm very interested. I know a lot of practitioners are interested in how many of those requests are made and what websites are doing to take those images down. And then trafficking, I think, you know, the link between technology, TFA, and sex trafficking specifically, really needs more data, because of course abusers will threaten to post images in order to keep a survivor from leaving. It's one of the primary ways traffickers post advertisements, recruit for the sex trade, and we just need a lot more information about that specific niche arena of TFA, I think, to really address the problem.
Thank you, Elizabeth, Kate, Maria, all our panelists for today. And that was a good reminder around the Take It Down Act, because that's an example of data informing policy. And now we're going to see how policy is leading to changes in practice and behavior. So thank you to everyone. Thank you to our partners at the CDC and all our HHS partners online. And really our intent here was, in a short period of time, our hope is that all the participants, you're walking away with at least one tidbit of information to inform more research, more data analysis, putting data into practice, informing prevention and legal services and health, behavioral health, other social services. We know that this is an ongoing effort, but we're really happy to be partnering with the CDC to be able to pull in so many perspectives on just a pulse check of where are we right now with the state of technology facilitated abuse and our respective mission sets. So thank you again, everyone. The recording will be available for all registered participants, and we will see you at our next quarterly webinar. Thank you.